Ketamine is it's a medicine that's been around a while. I'm sure you all know it's been around in the medical community and the veterinary community since I think the 60s, 70s. It's a dissociative anesthetic. However, in low doses, it's an off-label treatment for things like depression, anxiety, PTSD as an off-label medicine. So as a psychedelic assisted therapy program here at New U, what we do is we combine the ketamine with therapy. So with psychotherapy together to create ketamine assisted psychotherapy. And we feel that with the psychotherapy, it can really help make lasting effects of these, depression, anxiety, trauma, and even just kind of feeling stuck. It can really help alleviate a lot of those symptoms much more effectively when combined with therapy. Although ketamine in itself has been proven to alleviate depression on its own. That's kind of how they found it as a medicine in the first place. They were finding patients were coming out of surgeries and feeling kind of the effects of the ketamine and having it affect their mood in a positive way. And so they started studying in the medicine, and they found, all sorts of wonderful things interesting things. They're still studying how it affects the brain, but it really uses the GABA receptors, which are not as sexy as like serotonin and dopamine, but it uses different receptors in the brain to really help alleviate, help lift mood. So what we do here at New U Therapy Center and Family Services is we use low dose ketamine to treat depression. And we use it through two different ways. We use through lozenges, which is orally through the mouth. We give you the ketamine, and we work with a therapist, and that way can actually be done from your home. Actually, it can be done virtually. Which is really interesting and kind of nice, and especially nice during something like the pandemic when we're all virtual now. We also offer ketamine injections in our clinics. So we offer them both ways, and our licensed psychologists and psychotherapists will work with you to decide which treatment protocol is best for you, and what your dosage will be like, and what you feel comfortable with. So during the consultation, we'll get through all that to decide which is best. But just to say that ketamine is incredibly safe. It's a safe medicine, and we take it very serious. That's why we have a full team here at New U of medical professionals and therapists to make sure that your experience is safe. We want to make sure that the setting that you come into for your therapy treatment is conducive to your healing work.
Maybe let's say a little bit more about how it works. I know Alicia has talked about in the office setting, it could be intramuscular through our medical team and psychiatry team. And then we, as the ketamine assisted psychotherapists, we are there for your entire journey. It takes about a few hours in the office. If you're in the home, it's kind of comfortable, right? You can set your own home in a certain way. And just so that y'all know, as your guide, we are guiding you, the meanings that come behind the experience, we guide you there. And you are an expert at your own life, and we're here to journey with you if you like us to be here for your journey. And so we want to talk a little bit about what it looks like, how does it work? And again, Alicia has talked about, it's about your internal world. We go day to day, and we're often absorbed by the things around us. Taking a moment to pause, to take care of yourself, giving yourself that permission to rest, find that release from your day-to-day stress, whether you're the executive or you're on the ground with EMT services or in the hospitals during this very strange time. This is a great innovative service, a great innovative product to really add extra support to those who want that support for this or for the professional or the personal life. It's up to you. We are here to walk with you on your journey. One of the things we want to share, it is definitely safe. And I could tell you, I've also had my own journey with the ketamine itself, and it's really safe. It's really safe. And again, you have a team of folks that you work with, and it's really about what your starting point is. We are here to work with you wherever you may be today.
Yeah, and I'm going to add, one of the things that is really interesting about ketamine is that it kind of it puts a kind of a space between how you see the world in your everyday kind of like day-to-day operations. It kind of dims it dims your perspective, so you have a different point of view that's almost, it's softer, um, and it can really help to foster insight into kind of what's truly going on inside, kind of underneath everything, to really help you get clarity, self-compassion, and really get to who you really are. Because that's our goal here, is to kind of really work with, like Lisa said, your internal healer, to really uncover, the layers and the barriers that have been affecting. We all have them,